Hello and welcome to WVU Medicine Tuesday Talks. I'm your host, Mary Ravazio Menard. If you've ever had knee or hip replacement surgery or know someone who has, you know it's a big deal. But with advances in anesthesia and pain management, it's gotten a little easier. Now it's possible to undergo total joint replacement surgery and return home to recover in the same day. How so? Orthopedic surgeon Dr. Matthew Dietz from the WVU Medicine Center for Joint Replacement is here to tell us all about that and more. Well, welcome to Tuesday Talks, Dr. Dietz.
Thank you for the invitation to share a little bit about our program.
Yes, we've got a lot to talk about today. We do encourage you to post any joint replacement questions you may have in the comment section below, and we'll try to answer them live. So, Dr. Dietz, before we get started, I feel like I have to have full disclosure here. I have had 2 knee replacements, one at a time, and you have handled both of them, and they were successful and spectacularly uneventful, which I love. So we've got a lot to talk about.
I always take a little partial credit. I think that a lot of the credit goes to the patient. Then we have a fantastic team behind us that really facilitates a quick recovery for our patients. And I think that's paramount to the success of this program.
Definitely. That's the only way to get you to do it again.
Yep.
You know? Yeah. So we wanted to talk about same-day total joint replacement today. So let's first talk about what exactly same-day total joint replacement is.
Sure. So same-day total joint replacement is where you come in for an elective hip or knee replacement or a partial knee replacement, and we perform the surgery, and we expect you to be home later that afternoon or early evening, recovering at home as opposed to staying overnight in the hospital.
Okay. So what are the benefits of doing it this way?
Well, I think the benefits are that you get to be home, that when I don't feel well, when I'm achy, tired, or sore, I want to be home. I don't want to be in the hospital. And when you come as a total joint patient, you're a well patient. You're not sick. And so you don't necessarily need to be in the hospital in order to recover. In fact, we've been able to take steps to make it safe for you to recover at home. And I think patients actually do a lot better in that setting.
Yeah, they're more comfortable at home and
get better rest, better sleep, able to encouraged to mobilize a little bit more than in the hospital setting where you might feel restricted or somewhat hesitant to get up and walk about.
Okay, that makes sense. So how long have you been doing same-day joint replacement? I mean, this isn't really brand new, right?
No, this has been an evolution. You know, when we started back with the Center for Joint Replacement, we started with an accelerated recovery program, and we had tremendous success where our length of stay was beating the national average time and time again. In fact, one of our physical therapists joked that we kept patients really for pancake therapy, that they would come and stay for pancakes the next morning, then we'd get them out soon thereafter. And so then a national trend across the country has really been looking at accelerating that recovery. Can patients go home the same day and facilitate that in a safe manner? And so we've slowly transitioned to that program over the last 5 years to where we initially started out, it was around 7% of our patients were same-day total joint patients. Over the past 6 months to a year, it's really about almost 2/3 of our elective total joint patients are going home the same day.
Wow. So is there a lower risk of infection?
Well, certainly one of the concerns whenever you're in the hospital is a hospital-acquired infection. We know that there's other sick patients. Our nursing staff, our clinical staff are seeing other patients, so there's always that risk. I think what's really important to understand is that same-day total joint replacement is very safe, and there's no greater risk with that versus a regular admission for a total joint replacement.
I know, I had my second knee replaced during COVID, and I know it was better off, let's just move along.
Necessity is the mother of invention, and unfortunately
Yeah.
COVID forced us where admission to the hospital wasn't always possible for some of our elective procedures. And so this made us reevaluate some of our patients and really look at our criteria. And a lot of credit goes to our Orthopaedic Medical Optimization Program, where we looked at those criteria. Who could we safely offer those joint replacements to and get them home in a safe fashion? And so we're actually able to extend our criteria to include more patients that we could offer this procedure to.
Is there any difference in speed of recovery, whether you recover at home or stay in the hospital?
I think that the patients are encouraged and get mobilized quicker when they're at home. And I think part part of that is taking ownership in their recovery, meaning that they're anticipating, they're engaged from the outset, that they're motivated to get home. And so I think you naturally see those patients tend to recover a little bit quicker. We do know that patient-reported outcomes are higher in that select patient group, so I think they're more satisfied. They feel like they've recovered quicker.
Yeah, yeah. A lot of it's psychological too, huh?
A tremendous amount of it, and if you think about what keeps people from going home, there's a lot of anxiety. Anytime you talk about surgery, there's always concerns about the unknowns. And what we try and do as a team is we really try and establish, what we're going to do for you, what's going to happen step by step, and we legitimately give you a playbook so that you can go back and reference it. Because as I tell you something,
Yep.
a lot of times you kind of get a blank stare back and you don't remember everything that I went over with you. Then we bring you back and you have a class, and the class can now be offered online or in person. And I think that makes it a little bit more convenient for patients as well. And so I think it's providing that information. We also encourage patients to have a coach, so a family member, a friend that's going to be involved in the process so they can help remember some of those details, then also can help facilitate things when they're at home, encourage them to do their exercises, to get them up, to remember what the staff had told them before.
And the playbook is very helpful. I still have mine.
It's amazing. Patients will come back, they'll have it annotated, they'll have bookmarks in it, they're ready to go.
Yeah, definitely. So are there any risks to, doing this same day?
The biggest risk and what you would worry about is reasons for readmission. What would bring you back into the hospital? And what we really found was a lot of these things were being induced by what we were doing for you in the hospital. So nausea is a big problem in terms of post-operatively. Ways that we can limit the nausea is we screen patients for it. If you've had bad experience with anesthesia in the past, we pre-medicate you. We avoid narcotic medications, and I think that helps tremendously on so many different levels. And we try not to dehydrate you as much, so we want to keep you hydrated so that you're not getting hypotension or low blood pressure and feeling that kind of wooziness. We want you to be up on your feet and moving as quick as possible.
And you do. I mean, because I do. I remember with both procedures, as soon as I was back in my room, shortly after recovery, and I was down in the gym walking down the hall. And
I think what's great is with the anesthesia we provide, as soon as they turn that medicine off, you're pretty much wide awake.
Yeah.
Once you get up to the floor, our therapy staff is fantastic. They're usually waiting at the door, helping you get from your gurney over into the bed that you'll recover up on the floor. And then they're checking on you routinely. And our nursing staff up there is fantastic as well. They know that when you're ready to mobilize, they want to get you up and get you moving, get you a tray of food, and get you hopefully out the door as soon as they can.
And it does make you feel not like a sick person. It's just like, oh, yeah, I can do this.
Yeah, and I think that's the expectation, is that you're not sick. This is, you've taken these steps to kind of gain some of your life back, and that we expect you each day to be better than the one before that.
Sure.
So I think that's where we want to have that team mentality where everybody along the path knows what's going on and what to expect. That's our care managers, whether it's Felix or Jamie or Dan, that are going to help you figure out what you might need to get home and get home safely, what medications, and how we can overcome those hurdles. It's having our nurse navigator, Cindy Drummond, is there available for you to just provide any information that you might need. And I think that helps allay a lot of the fears, because one of the concerns is, well, what if tomorrow I feel this? What if tomorrow Cindy calls everybody the next morning to check in on them? And I think that really helps patients deal with a lot of those concerns, knowing that they have a point of contact that they can get in touch with if anything were to be concerning to them.
Yeah, I can speak for that awesome team, excellent team. We have a question from one of our viewers. It says, I'm immunocompromised and had my knee replacement in Pittsburgh, and my doctor made a point of sending me home that day. I fell backwards the next day, so I'm thinking that maybe I want to stay one night when I have the second knee replaced in October. I'm a fall risk in general and have rheumatoid arthritis. Thoughts?
So there are criteria that we look at in terms of screening patients to make sure it's safe. So some medical issues do keep you in the hospital overnight, where we want to take extra precautions. We also want to assess your gait and how safe you are getting around. Some patients we feel like might need some additional assistance, maybe some additional time working with our physical therapist in the hospital, so we can do a proper safety assessment, make sure that you can get home safely, because that's what you don't want to have happen. You don't want to go home, feel weak, fall, and then cause yourself a bigger problem, especially if you're in that immunocompromised state or rheumatoid arthritis. We know that there are higher risks for infection, that sort of thing. The last thing you need is a fall or a scrape over top of that fresh knee incision.
Sure. So this isn't for everybody, or
no, it's not.
Is it?
It's not for everybody, and I think that's really important that you're aware of it and that you ask your surgeons if they have a program for it, and then also if you would be eligible for it. There's certain, and I think you want to have an honest assessment there. I think that we're very good at looking at that whole picture. In the past, the question was, could I survive surgery? The surgery is so safe. It's safer than driving to your local grocery store, depending on where you frequent your grocery store. But the overall, it's a very safe procedure. And what we want to do is give you the best and quickest recovery. And so our medical team is excellent in terms of evaluating our patients and saying, is this safe or not for you to participate in?
Okay. So who is a good candidate for this surgery?
So I think patients with fewer medical problems, younger, healthier patients are certainly kind of at the top of that list. But I have plenty of 75, 80-year-old patients that are extremely active and healthy that physiologically are healthier than some of my 50-year-old patients. And so those are patients that we can certainly consider as long as they're meeting criteria that aren't too concerning for us.
Okay. Makes sense. So this isn't just necessarily for the younger, healthier patients.
No, I think this is for someone that's motivated to be recovered quicker, to get up and get moving around.
Okay. So is pain management handled differently for same-day surgery patients as opposed to somebody that is likely to stay overnight?
From a pain management standpoint, it's amazing how it's evolved over the last 15, 20 years, where it used to be you got more and more narcotics, which causes problems with there's a morphine pump or you sat in the hospital bed for days and days. We really try and limit the narcotics. Either way, we're trying to do some type of neuraxial or spinal anesthetic. A lot of patients are exposed that are familiar with it as an epidural catheter. It's a little bit different than that. It's only one shot, and the catheter doesn't sit in there. And so it allows you to get up, you get less spinal headaches, that sort of thing. We're trying to limit the narcotic pain medications, but overall the protocol is very similar in terms of pain control. We want to have that multimodal pain control. We're not just relying on the pain medication. We have anti-inflammatories. We use acetaminophen. We use other modalities to try and affect the pain and shut down those pathways so that the response isn't as great for the patients. And I think we've had tremendous success with that.
That's great. And I also noticed, I remember, through the playbook and everything, that prehab plays a role in being able to go home sooner. So tell us about what prehab is and why it's important.
I liken it to just like you would train for the big game, the big race, or the big fight. You're trying to train to get ready for a joint replacement. As you lead up to a joint replacement, we make lots of accommodations. I put my shoes on a different way. I put my pants on a little bit different way. My spouse has to help me get my shoes and socks on. You have to make accommodations. Or I can still go out on the farm and do certain things, but I get on the tractor differently. And every time we make those accommodations, we're probably getting a little weaker in some of our muscle groups. And so the idea is that before surgery, we're trying to really facilitate engaging those muscle groups again, getting that strength built up, also getting some of your physiologic reserve built up so that when you undergo the stress of a surgery, which it is a stress, that you're ready to recover and take it on head on. And I think it's tremendous the results you see in those patients that have engaged in the prehab beforehand and how they recover so much quicker post-operatively.
Oh, I did. I was a good patient.
You were an excellent patient.
I was. I did my prehab, but it made a big difference. And it just gave me more confidence in physical therapy and
it takes
else.
away some, the easier time to train for those things. To have a therapist telling you what to do when maybe you're a little achy or sore recovering from surgery is not right after surgery. If you've learned those exercises in the weeks or the months beforehand, all of a sudden those becomes a second nature to you, much easier to utilize in a recovery period.
And we have access to those exercises and all that information
So
through the Joint Center.
Not only is it in the playbook, it's also online where it's available. If you forget what we went over in class, you can always refer back to it. It's a great resource for patients.
Yeah. Okay, what about, you were talking about how pain management can be handled differently. What about anesthesia? Is that handled differently for same day?
So I'd say over 90% of our patients have what's called a spinal anesthetic. And so the anesthesiologist will come out and talk to you. They'll give you some medicine to make you comfortable, but then we make you numb from the waist down. And what's really nice about that is it really helps with pain control after surgery. And then during the course of the surgery, you can be as awake or asleep as you want to be, but you're breathing on your own.
Right.
And so that makes it a lot less anesthetic that you have to have. And so just like I said, once the surgery's over, we're walking into the recovery room, that medicine's turned off, you're pretty much wide awake, talking, asking how everything went and what time it is and when can you have coffee.
Right, right. And it does catch up, because I do remember the first time when I woke up and I was still a little numb.
Yeah.
From the waist down, I was like, hey! But it came back.
No, it comes back very quickly, and it works great.
Yeah, it does. It does. So what role does your home support network play in determining whether or not you're a candidate for same day?
I think it is important that you have some support at home to help facilitate that. You know, even if it's something as simple as getting your dinner plate to the table if you're using a walker, someone there to help you a little bit with the first couple of days makes it much easier and safer for you in those first couple of days. And it doesn't have to be 24/7 care, but it needs to be someone that you can rely on, that if you needed help with something, that they're there. Also there to encourage you that, hey, maybe you should be getting up and not just sitting on the couch all day. We need to get you up and moving when you're at home too.
Every hour if possible, right?
It's like you were trained.
I know. I had a good teacher. What if a patient doesn't feel ready to be discharged to home the same day? You know, because, well, that happened to me. You know, we were planning, I was going to be same day, but I didn't feel ready.
Yep, and there's can be lots of different reasons for that. Some of it could just be anxiety. Sometimes it could be the patient's a little bit nauseated, doesn't feel well. And I think it's important that you understand that that's never we're going to listen to what you need. And if you need to stay overnight, that's what we'll do. And so even in times where we're limited in our admissions, we still had to admit some patients overnight and keep them overnight. Now, they're still probably ready to go for pancake therapy the next morning. But then I think we take care of the patients and make sure we do what's best for them. And I think that's what it all comes back to with this program, with getting a joint replacement, is we want to do what's best and safest for you.
Yeah, that's for sure. Okay, so tell us a little bit about the experience and expertise at the WVU Medicine Center for Joint Replacement. I mean, because it's just basically a team of rock stars.
You're going to give them big heads. You know, we have, it's starting with our joint surgeons. We have 5 fellowship-trained joint surgeons, all performing cutting-edge technology surgery with the latest and greatest in terms of innovations in rehab. But I think more importantly behind that, we have an excellent team where we have quarterly joint center meetings where we go over the criteria. How good have we done in that past quarter? How can we make things a little bit better? And at this point, we're beating national averages on so many different fronts that it's just tweaking little things here and there. But I think it's important to look at your results and see how we can do better. And so we have a fantastic nursing staff that is supportive all along the way. Physical therapy is engaged from the outset, where they're there participating in the class to waiting for you getting off the gurney from the recovery room. You know, we have the care management team that I think you really need to have invested in trying to prepare everything, making sure that, you know, insurance is going to pay for the prescriptions that we write for you, that we're going to have the walker ready for you. You want to take all those question marks out so that you can focus on recovery. You know, having your anesthesiology team engaged so that we're all on the same page, so that one person's not telling you a different story. You know, if someone in the recovery room says, "Oh, but my grandma stayed for 5 days," all of a sudden that introduces a little bit of doubt into the patient. So you really want everybody to know what the patient's experience is going to be, and we've done a great job of that here at WVU.
That's great. So tell us why, so, you know, if someone's thinking of this, why should they come to WVU Medicine as opposed to going somewhere else?
You know, I think here we're trying to provide you the best care that you can get back to your daily life. That I think that the greatest satisfaction I have is when a patient can come back and tell me stories that they can go back on fishing trips with their buddies, that they can get back on the tractor and work on the farm with their friends, that they can get back to the office, they can get in and out of the truck without difficulty now. And it's amazing the satisfaction that we can see from that. And I think that we take care of some of the most challenging situations in terms of patients that are denied surgery at other locations because of the complexity, because of the other medical issues that are there. And so when we are experienced to take care of all of those other challenging situations, a hip and knee replacement becomes very straightforward and routine. And I think that's what really we see with the same-day total joint patients. We take away that mystery from you.
Yeah.
I think we make it a safe experience. I think you are reassured by that team environment as well, that you're well supported and you're going to recover fantastic with it.
Okay. So what's the best way then? If somebody's interested in this, should they go to the website? Should they call? What's the best way?
Easiest way is probably to get onto the website, find
WVUmedicine.org/joint.
And when you get there, you can peruse all the information that we have there about our surgeons, about our program. We're very proud of the program. It's been a lot of work over the years to try and fine-tune it to where I think we have an excellent representation of how we can care for the patients of West Virginia. You can call the office, have your physician make a referral over to us. We're happy to see you and hopefully take care of you.
Yeah, it works. It works. Okay, so before we go here, what's the most important thing you want people that are watching this to remember about this procedure?
I think it's to be engaged in the process. I think in the past it's been, I'll just take whatever my doctor says is that's what it should be. And I think, ask questions. Don't be afraid to ask questions. I always tell patients, it's your hip or your knee. You should be able to ask any questions that you want. No questions off the books, whether it's, infection rate, whether it's, odd things in recovery, whether it's how quickly can I getting back to certain activities in my life. Nothing's off the books. We have pamphlets and papers explaining every aspect of the recovery.
Yeah, you certainly do. Well, thank you so much. We've got a lot of good information here today. Thank you for being with us, and I can speak for this. I would do it.
Well, thank you very much, and obviously you're a poster child. We're going to hire you back to have you come back and teach the class for us.
Okay, thank you. All right, so that brings us to the end of this edition of Tuesday Talks. If you're looking for more information about same-day total joint replacement surgery, visit wvuMedicine.org/joint. I'm Mary Ravazio Menard, and on behalf of Dr. Dietz and everyone at WVU Medicine, thanks for joining us and have a great day.